Hey friends, welcome back. We'll look at letter of intent as part of this lecture. So what I've done is I've highlighted the important part of the letter of intent. So letter of intent is the first formal step when you're interested in buying a business or any kind of business. So do the dental practice. So it starts with the name of the purchaser. They will define Dr. ABC, Dr. Joe Patel is the purchaser, Dr. Richardson is the seller. Okay, so that from a legal point of view, this is clear. And then we have defined the purchase price. All the assets that we are buying are for $90,000. So what is that you're buying? Practice to be purchased, they will define it. It's a website and domain name, patient file records, any electronic copy, model charts or x-rays. Phone number will be transferred to the buyers. All the equipments. I have not gone into the specific list, but all the equipments that business is using to perform the required function. Okay. Use of seller's name. Usually during the long duration of the practice, seller has name on various places, including websites. So you should be able to use the name of seller for usually 12 months to 24 months. Okay. Then there's that they're defining what is that it is excluded out of the purchase. Any money that is there in the bank accounts for the company, equipments that are not being used there. Okay, payment method. So they've defined how will the payment be made. So here's the first deposit. First deposit is $2,000 and remaining balance will be due at the signing of purchase, sale and purchase agreement, and it will be a certified check. Okay, so certified check is a banker's check. Once you give them the check, they will validate with the bank, call them and hey, the check is clear or not. C, they have defined personal goodwill. So when you buy a office, they divide into two parts. Goodwill, where the seller will have to pay only capital gain taxes. Good for him. Equipment, good for you because you can write off. So make sure the allocation is appropriate. Usually brokers will push for maximum amount of money in the personal goodwill and will have very little amount in the equipments. But if the equipments are actually $100,000 value, you should have that, because you will save about $30,000 on your tax in the first year itself. Okay, your accountant will be able to write it off. Then condition of the performance. So the sale and purchase should be executed within 30 days of acceptance of the letter of intent. Okay, then there's a non-compete, that the outgoing dentist will not work in the area for 5 years and within 8 miles. Okay. Then you should, as a buyer, you should be able to work out the deal of lease terms, right? If there have been cases where the new seller has not been able to finalize the lease terms, either because the landlord said, hey, I'm going to increase the rent, or hey, I don't want to give you the rent, I don't like this guy. So that basically is very important. If you're not able to finalize the lease agreement, the entire purchase is of no use for you. Okay, transition period. Basically, this defines how long the outgoing dentist will support you. As a guideline, lesser the time outgoing dentist is in the campus, better is for you. Okay, it is good to let him go. You will get over it. Okay, we'll discuss these issues during the transition and issues that you face. Okay, and then last, confidentiality. At the end, it will be signed by the buyer and the seller. So that's at high level the letter of intent would look like. Usually the broker will have a standard template. They will fill it up, send it to you. You just have to sign. So don't be too afraid. This is the start, first step in terms of buying a practice. Thank you so much, and I'll see you in the next lecture. Bye.